So my name is Kat Wojewoda. I am the registered dental hygienist at MyCare Dental Care, and I would like to talk about some of the activities I do on a daily basis as a dental hygienist. So every day I come to work at least half an hour early to prepare for the day. I review all of my patients' charts. I review their personal notes, their social notes, any outstanding treatment, any treatment that was done in the past, just to be prepared for the day and engage the patient in a conversation. When it's time to bring the patient in, I walk down the hallway and I make sure I keep an eye contact to see who's actually sitting in the waiting room. I call the patient by their first name and their last name, unless I know them already from the past. As I bring them down the long hallway, I make sure I always walk the patient beside me or ahead of me. You want to be engaged with that patient right from that minute. You want to create that connection with the patient as soon as you can. This is your first chance to actually engage the patient and create that connection. As soon as I walk them down to the hallway and I seat them, I also make sure that I sit down right in front of them at an eye level, knee to knee, and ask them how they're doing. Are there any concerns? Do they have any sensitive teeth? Are there anything that they would like to discuss before I begin any of the treatment? While I'm still looking at them, I also review their medical history, if there's anything new, any new medications or any allergies that they might have. As soon as I completed all the assessments, I do let them know that I will put them back before I even do that. Make sure that you let them know that you're going to put the chair back. You don't want to just kind of spring that on them. And as soon as they're laying down, you want to make sure they're comfortable. Is there anything I can provide for you? Do you prefer a neck pillow? Can I get you a blanket? Are you comfortable in the chair? Would you like the TV on, or do you prefer just to have a quiet room? Before I begin the treatment, I also make sure I assess if there's any sensitive teeth before I even begin the treatment. Are you sensitive to cold, or are any other areas of receding gums? That way I'm prepared before I even start to make sure that I don't cause any sensitivity to the patient.